Tay-Sachs disease is a genetic disorder that results in the destruction of nerve cells in the brain and spinal cord. So as we can see, there's a cherry red spot as seen in the retina in Tay-Sachs disease, and the fovea center appears bright red because it is surrounded by a whiter than usual area. So a person with Tay-Sachs disease will initially feel the decreased ability to turn over, sit, or crawl. Later, he or she will feel a seizures, hearing loss, and inability to move. For the other signs and symptoms, we have infantile, second juvenile, and third we have late onset. So for the infantile, those infants with Tay-Sachs disease appear to develop normally for the first 6 months after birth. Then, as neurons become distended with GM2 gangliosides, a relentless deterioration of mental and physical abilities begins, and the child may become blind, deaf, and unable to swallow, and even he or she will become paralytic. Of course, death will usually occurs before the age of 4. Then for the juvenile, those persons with Tay-Sachs disease, with juvenile Tay-Sachs disease rather, is rarer than other forms of Tay-Sachs, and usually is initially seen in children between 2 and 10 years old. Then people with Tay-Sachs disease experience cognitive and motor skill deterioration, dysphagia, dysphagia, ataxia, and spasticity. And for the late onset it is a rare form of this disease and also known as adult onset or late onset Tay-Sachs disease. And it is usually has its first symptoms during the 30s or 40s. And in contrast, the other forms, late onset Tay-Sachs disease is usually not fatal as the effects can stop progressing, and it is frequently misdiagnosed and characterized by unsteadiness of gait and progressive neurological deterioration. This disease can also be prevented through prenatal diagnosis. If both parents are identified as carriers, then prenatal genetic testing can determine whether the fetus has inherited a defective gene copy from both parents. Then we have the preimplantation genetic diagnosis. By retrieving the mother's eggs for in vitro fertilization, it is possible to test the embryo for the disorder prior to implantation. It is because healthy embryos are selected and transferred into the mother's womb, while unhealthy embryos are discarded. Then lastly, we have mate selection, which can only be seen in other places, just like in Orthodox Jewish circles, as they carries out an anonymous screening program so that carriers for Tay-Sachs and other genetic disorders can avoid marrying each other. So as you can see on the illustration, there's a pattern from the mother and father connected to their children. So this pattern is what we call autosomal recessive pattern. So in other words, Tay-Sachs disease is an autosomal recessive genetic disorder, meaning that when both parents are carriers, then there is a 25% risk of giving birth to an affected child with each pregnancy. Then the affected child would have received a mutated copy of the gene from each parent. So, Tay-Sachs disease is caused by the absence of a vital enzyme called hexosaminidase A. Without hex a fatty substance or lipid called GM2 ganglioside accumulates abnormally in cells, especially in the nerve cells of the brain. So, if both parents are carriers and their child inherits the defective hex A gene from each of them, then the child will have Tay-Sachs disease. That's the end of our report, and always remember that Tay-Sachs disease has no cure but can be prevented.